Have you ever wondered why your kids are having trouble concentrating at school? Or maybe why the rate of ADHD and other chronic conditions in children is rising so rapidly? In this video, we're diving into an important topic that may surprise many of you. Why you should avoid giving folic acid to your kids. Folic acid, often regarded as essential for health, can have nuances in its application that parents need to know. So stay tuned as we explore the reasons why folic acid may not always be as beneficial for children as it's often perceived to be. First, let's talk about what folic acid actually is. Folic acid is a synthetic form of folate, known as vitamin B9, which is a water-soluble vitamin that plays a key role in making DNA and other genetic material. It is essential for cell division and the formation of red blood cells. You're probably aware that it's highly recommended for pregnant women due to its role in preventing neural tube defects in developing fetuses. However, this same vitamin is often included in multivitamins and fortified foods, leading many parents to give it to their children as a routine supplement. Foods like cereals, bread, flour, and enriched grains contain high amounts of folic acid. All these foods are popular breakfast options regularly consumed by children. But here's the catch. Excessive supplementation may not be what's best for your child's health. Folic acid is important, there's no doubt about that. But the human body metabolizes it differently than naturally occurring folate, which is found in foods such as leafy greens, citrus fruits, and legumes. While natural folate is beneficial and necessary for proper body function, folic acid, the synthetic form, requires the body to convert it into its active form, methylfolate, for use. This conversion process can sometimes be inefficient, especially in those with certain genetic variants like the MTHFR mutation, which is relatively common. For children who do not have the necessary enzymes to convert folic acid efficiently, excess levels can build up in the bloodstream. This can lead to potential health risks that parents should be aware of. Research has found that high levels of unmetabolized folic acid in the body may lead to problems such as immune system dysfunction and potential impacts on neurological development. While these studies are still emerging, they provide a compelling reason to approach folic acid supplementation with caution. Potential risks. Let's take a deeper look into the potential risks associated with giving folic acid supplements to children. Immune system impairment. Unmetabolized folic acid can interfere with the function of the immune system. One study indicated that high levels of folic acid might inhibit the body's natural response to certain pathogens, making children more vulnerable to infections and diseases. Developmental concerns. Research has linked high folic acid intake to cognitive and behavioral issues in children. While folic acid is necessary for brain function, excess supplementation could be linked to problems with learning and attention. Cancer risk. There is growing evidence that too much folic acid might be associated with a higher risk of certain cancers, particularly in cases where a child already has undiagnosed precancerous cells. Folate plays a role in DNA synthesis, and when there is an excess of folic acid, it could potentially encourage the growth of existing abnormal cells. Masking vitamin B12 deficiency. Folic acid can mask vitamin B12 deficiency, which is a significant concern for children. Vitamin B12 deficiency can lead to serious neurological and cognitive issues. Because folic acid can correct some of the anemia symptoms associated with vitamin B12 deficiency without addressing the underlying problem, it can delay diagnosis and treatment, ultimately causing damage. Healthcare professionals and researchers are increasingly questioning the routine use of folic acid supplements in children. While it's well documented that folate is necessary for healthy development, too much synthetic folic acid may pose risks. The American Academy of Pediatrics, AAP, states that while folic acid is important for pregnant women and certain vulnerable groups, most children get adequate amounts from a balanced diet that includes folate-rich foods. Experts recommend that parents focus on providing a diet that is rich in natural sources of folate. This helps avoid the complications associated with synthetic folic acid and supports healthy development. Foods like spinach, broccoli, lentils, and citrus fruits are great sources of naturally occurring folate, which is better for the body to absorb and utilize. It's important to understand what levels of folic acid could potentially be problematic. The recommended dietary allowance, RDA, for folate varies by age. But for children, it's generally considered safe when it comes from food sources. However, supplementation above this amount, particularly in the form of synthetic folic acid, should be approached with caution. The tolerable upper intake level for folic acid is 1,000 micrograms per day for most children, which is not difficult to exceed if they are taking multivitamins and eating fortified foods without proper oversight. For many parents, it's easy to assume that adding a folic acid supplement will do no harm, but the risk comes from how the body processes the synthetic form. The body doesn't process folic acid in the same way as folate, which can result in high levels of unmetabolized folic acid in the blood. This excess is not always beneficial and can contribute to negative health outcomes over time. Tips to avoid unnecessary supplementation. So what can parents do to ensure their children are getting the nutrients they need without unnecessary supplementation? Here are a few practical tips. Encourage a balanced diet. Provide a diet rich in natural sources of folate, such as leafy greens, asparagus, beans, lentils, nuts, and citrus fruits. This supports healthy growth without the risks associated with synthetic folic acid. Be wary of fortified foods. Be aware of foods that are fortified with folic acid, such as breakfast cereals, breads, and snacks. While these foods can be part of a healthy diet in moderation, they should not be relied upon as the sole source of folate. Consult your pediatrician. Always consult with a pediatrician before giving any type of vitamin or mineral supplement. They can help determine whether your child's diet meets their nutritional needs or if supplementation is necessary. If supplementation is needed, a healthcare professional can help recommend the appropriate types and dosages. Know the signs of folic acid overload. While rare, high levels of folic acid in children may manifest as fatigue, irritability, ADHD, or digestive issues. Keep an eye out for any unusual changes in behavior or health and report these to your pediatrician. Myths about folic acid. Now let's address some common myths that might be leading parents to believe that giving folic acid to their kids is always a good idea. Folic acid is only important for pregnant women. While it's true that pregnant women have higher folate needs, children also need it for growth and development. However, the key is to ensure they get the right amount from natural food sources, not synthetic supplements unless specifically recommended by a doctor. More folic acid is better. This is not true. Excessive intake of synthetic folic acid can lead to various health issues, as we've discussed earlier. The body needs just the right amount, not more, not less, to function properly. Multivitamins always help. Many parents assume that if a multivitamin contains folic acid, it's safe and beneficial. However, this is not necessarily the case, especially when the diet already provides sufficient folate from food. Oversupplementation can have negative consequences, so always check the dosage and talk to a professional. In conclusion, while folic acid is a crucial nutrient for human health, it's essential to understand the potential risks associated with its overuse, especially when it comes to children. A balanced diet full of natural sources of folate is typically enough for most children to thrive. Over-supplementing with synthetic folic acid can lead to complications that parents may not expect, including immune system issues, developmental concerns, and masking important vitamin deficiencies. As always, it's best to approach dietary supplements with caution and consult with healthcare professionals when considering their use. Your child's health and safety are the top priority, and staying informed is key to making the best decisions for their well-being. Thank you for joining us today, and don't forget to like, subscribe, and hit the notification bell for more health-focused content. Stay healthy and see you in the next video.